We are starting with spine ROM. Okay. Now we will see cervical spine range of motion. So we know the movements now. Cervical spine ROM. We have flexion, extension, lateral flexion, side flexion, and rotation. So first cervical spine range of motion. So we will see for flexion first. So before going to measure range of motion, first here we will see this is external auditory.
Yes.
This is mastoidum. Here we will be having occipital corners. This is center means the base of the nose. We have to know all those points. Then, okay. Now we will see. So here we are going to measure the first cervical spine flexion. So before doing that movement, first we have to do passive flexion. We will do passive flexion once. So here I did passive flexion once. Okay. Now patient knows that what is that movement, passive flexion. After that we have to measure range of motion with the Goniometer. Okay. So here I am taking it into 90-degree position, 90-90. So fulcrum, see here no, fulcrum, it will be over the external auditory meatus, external auditory meatus fulcrum, and then see external auditory meatus and movable arm. Movable arm will be exactly to the base of the nose, exactly to the base of the nose. Movable arm to the exactly to the base of the nose. Stable arm perpendicular to the ground. Stable arm perpendicular to the ground. Okay. Now we will ask patient. Now we will ask patient to do flexion. Do flexion. Okay. Right. Okay. So after the flexion movement, this movable arm should be same place at the base of the nose. So then we will measure the ROM. Then we will measure the ROM from 90 degree. How much it will come? That only we will measure, because first we kept 90 degree. Now after 90 degree, how much it will come? That we will measure as cervical flexion. This is for cervical flexion. Now we will see extension. Extension also same. Position of the patient will be same, high sitting position. So here first we will do extension passively once. Extension passively once. Then that means patients will understand that's the extension movement. So whenever you ask patient to do extension, then he will do easy. Okay. Now again same, we are going to keep the 90-90 position. We are going to keep it 90-90 degree position. Then fulcrum over the external auditory meatus, and then movable arm at the base of the nose. Movable arm at the base of the nose. Then I will ask patient to do extension too. Okay. So when patient do extension, this movable arm exactly at the base of the nose. So relax. So here I got measurement from 90 degrees to 70 degrees. So that means 20 we can take it here. Okay. So it depends on patient. So from that neutral position, how much he did extension, that we are going to measure. Only point is where to keep fulcrum, where to keep movable arm, where to keep stable arm. That's the point. Okay. This is a flexion extension. Okay. Now we will see side flexion and rotation. Lateral flexion. This is our lateral flexion. So you can come now. So first we will do lateral flexion movement passively, so that patient will understand what is lateral flexion. After that we have to take the fulcrum. So fulcrum will be over the spinous process of the C7. See here we will be seeing spinous process of the C7. So fulcrum will be over the spinous process of the C7, and then this is a movable arm. Movable arm will be the center of the head, posterior. Okay, center of the head, and stable arm over the spinous process of the thoracic spine. Spinous process of the thoracic spine. Then we will ask patient to do lateral flexion. Lateral flexion. So here we can measure our range from here to here. What is the range we can measure? This is lateral flexion. Okay. Or rotation, cervical spine rotation. So first we have to do rotation movement. We will ask patient to see. This is our cervical spine rotation. Right side rotation, left side rotation. First we have to do passive. Then patient will understand what is rotation. After that we are going to see. Now we have to keep, see, like this 90-90 degree position we have to take. Then we are going to keep it at the center of the cranium. And this movable arm, which is here movable arm, it will be at the center of the nose. And this tabulum will be almost like to acromion process. It will be parallel to the acromion process. So like this patient position means goniometer position. Then we are going to ask patient to do rotation movement. When patient does rotation, then here we are going to see the range from 90 degree how much it can, that is the rotation movement. So like this we can measure cervical spine ROMs with universal goniometer. Clear? Bas.